Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and you've tried, you've applied, and you've come up with the same old, same old. Well, guess what? This might be the opportunity for you to put that fire out once and for all and to find out what really works without drugs, without surgery. 888-630-WMAL. Give me a call. Have some interesting tidbits for you today on this beautiful, absolutely stunning Easter Sunday. It's gorgeous outside. We all should be outside playing. So after you listen to my program, go out and go for a walk. And actually, we're going to talk a little bit about taking control of your body, losing weight, and building lean muscle. We'll get to that as we go through the program today. But importantly, I want to talk to you about some subjects that I think that you're going to be very surprised at. The data is outstanding. You know, low back pain and structural pain, spinal pain, is one of the things that is an ongoing dilemma for traditional practitioners because the way they treat it with drugs and maybe some hot packs and stretch and physical therapy generally doesn't work, and you need to know what the actual statistics are in this, and why does back pain reoccur, and how does it do? How does treating structure in one method opposed to another really make any difference? And the differences are huge, and we're going to talk a little bit about that today. There's an interesting guy who I've had the pleasure of meeting. His name is Anthony Rosner, PhD. He is one of the most brilliant researchers in the area of all kinds of things in healthcare out of Harvard University, now works for the International College of Applied Kinesiology, which I'm on the board of directors. Having said that, we're going to tell you some interesting things that he's been involved in today. But meanwhile, let's talk to you as well, 888-630-9625. Article came out, was published in 2010, this last December, in Spine Journal, and it was talking about the comparisons of taking medications for acute low back pain and doing other things. And it went on to say that, acute low back pain patients demonstrate significantly greater improvement, guess with what? With chiropractic care than any other type of therapy, period, end of story. And we're going to talk about that. The publication of chiropractic hospital-based intervention research outcomes, so it's called Chiro, right? Interesting link there. The study in the Spine Journal, one of the most frequently cited refereed spine research journals in the world. This is like the best of the best. Healthcare community at large across the board may finally appreciate what we've been touting for 35 years, and obviously for the length of chiropractic, that chiropractic care for mechanical problems of the low back has no competition. Absolutely no competition whatsoever. No matter what the intervention is, the therapy used by chiropractors, manual manipulation, and the things that we do with reflex work and so forth is far superior than anything else. And we're going to talk about what was the study that was published, and it goes on, and it took patients over a 16-week period of time, and they broke them up into segments of people who had gone to medical physicians of any sort and patients who had gone to chiropractors. And here's the interesting thing, that the study, and it was an extensive study, found that after 16 weeks of care, patients referred to medical physicians saw almost no improvement in the disability scores that the study was based on, and were likely at that point still to be taking drugs that the doctor had prescribed, in some cases more drugs, and saw no benefit even with added physical therapy. And yet these physicians, getting no outcome, were not likely to refer to chiropractors. Imagine that. Well, that's something that we've been dealing with for many years, but you need to know the truth because it's your body and it's things that are happening to you. So let's take on, medicine for right now. Let's talk about low back pain. We're going to talk about mechanical problems today. And why did I pick mechanical problems? Because most of you at one point of your life are going to suffer from this type of problem. the study was very interesting. It was a controlled trial comparing, clinical practice guidelines that are standard within all the professions, and we talked about, medical manipulation and physical therapy, and the manual modes that chiropractors used, and it was strictly for acute, real hot low back, flare-ups, and the researchers discovered that treating these conditions with chiropractic spinal manipulation dramatically, significantly showed improvement rather than any other form of therapy. So this makes you stop and think. So if that's true, and we're worried about the cost of healthcare today, and we also know that chiropractic treatment in acute phase care is far less expensive to parallel care in the medical community, and they get results, well, it says, maybe they should be looking at this as a primary mode and save maybe hundreds of millions of dollars along the way, since about 78% of you suffer from low back pain or will at some point of your life. The intervention research outcomes evaluated spinal pain management strategies involved specifically manual manipulation, and these therapies were administered in a hospital-based spine program and outreach clinic. The outcome was designed so that there would be no differentiation of whether it was whether it was medicine in the hospital and physical therapy in the hospital, or whether it was chiropractic care in the hospital. So ultimately, what they saw was the end piece of this, that 78% of the patients in the medical group were still taking narcotic analgesic medications on either a daily basis, and very few of them ultimately had been referred because they were supposedly locked into, if you will, the medical community. So here I am. I'm the guy that's been looking at this stuff for 35 years, right? I have had patients that I've treated from all different walks of life. Athletes, professional athletes, Olympic athletes. We've had the pleasure of treating over the years, many of the Redskins, and we've treated the Wizards, and we've treated the Mystics and the Caps and so forth. And you can imagine these guys get banged up pretty good, right? So they hurt, and they end up with, among many other things, low back problems. So when they come into the practice, often we get them after their team doctors, quote unquote, have already had their hands on them. And they're still in pain. They still have the problem. They're on drugs so they can play. Problem is, when you take medication, you suppress often the problem at a tolerable level, never really gone, so you can, quote unquote, play through it and end up doing far more damage and ensuing permanent disability than you would if that wasn't the case. How many of you go out and play tennis, or you golf, or you ride a bicycle, or you do something that's, just kind of go for long walks all the time, and you're in pain, and you push through it, and you decide, well, I'll take a couple of aspirin, I'll take a couple of Motrin, I'll take some Advil, whatever, so you can do that. Well, the problem is that when you give those medications, as we've said many times, the end product is you increase the risk of more rapid and more accumulated degenerative change to the joint space, to the mechanical structure of the body, simply because these drugs, NSAIDs, non-steroidal anti-inflammatories, compete with the absorption of something called sulfate ion. Now, sulfate, you've heard chondroitin sulfate and glucosamine sulfate. Well, see, that's what really heals the joint. That's what makes a difference in the joint space. So when you take those medications, instead of allowing the body's resolution to occur as it should in a natural way, in a natural form, you end up with major damage long term. It just kind of grabs a hold of you. It begins to build up over time, and you're not aware of it because you suppress the symptoms to a tolerable level. Not necessarily gone, but to a tolerable level. Remember, we're saying here that under medical care of any kind, including physical therapy, that patient generally is still in pain 4 months out, 16 weeks later. And they're still taking medication. And nothing's really been done to resolve the problem. Being intelligent human beings as we are, wouldn't that make you stop and think for a second that this ain't working? And if you're in and out of a problem on an ongoing basis, that there's another reason for it. Remember, if you've listened to the program on an ongoing basis, there's only 3 things that cause anything. One is injury to the body. The other one is biochemistry, things that you put into that body that shouldn't be there, things that you need to supply that you don't put in your system. And the third is stress, emotional pathway problems. The body doesn't know the difference between something that actually happens to it and something that you think about. It reacts physiologically the same way. It's an interesting paradigm, but it is the truth. It is the truth. And, we begin to think, why does low back pain begin to reoccur? Why does the problem continue to persist? One, because it's never truly been taken care of. It's only been, the pain pattern has been blunted. You've been given muscle relaxers, so not only one part of your body is not in spasm, but the rest of you is kind of put into a lousy place. But no true core strengthening rehabilitation has taken place either. My daughter, Erin, is a fitness trainer. And having grown up in this field, she understands the mechanisms of structural breakdown and imbalance and so forth from a very, very intricate way. And so we get into conversations, and we refer to her on an ongoing basis. So here's the interesting thing. We can fix somebody and get them so they're mechanically stable, but if we don't refer to her or other trainers or people who really understand the rehabilitative process, nothing ever resolves itself. Absolutely nothing. In the patient with long-standing low back pain, particularly when it's segmental, meaning it is one area of the spine, it has one piece of the low back or an upper portion of the spine that is involved, and even though the chiropractor does what he needs to do, or the osteopath does what they need to do, if that structural system is not rehabilitated, if it's not brought back to normal, if it's not normalized, if the motor control is not re-engaged, if you will, you're going to break down again. You're going to have problems again. So that's the structural piece. And the chemical piece is that so many of you are eating things that are so highly inflamed, so ridiculously jacked into your system, the sugars, the sodas, the coffee, the fast foods, the fried foods, the alcohol, the glutens, the preservatives, the additives, all that junk, right? That you're constantly causing acid burning within the system, and when that takes place, degeneration takes place. Destruction takes place. So you have to change many things, not just stopping lifting or getting a little weight off. And we're going to put that piece all together for you today. We're going to show you what you need to do. In the meantime, call me at 888-630-9625 on any subject, whether it's low back pain or you got a cholesterol problem. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Talking about low back pain, and we're going to get into back surgery and why there's too many and they're too costly and they're not effective. And you need to know that. In a world where we're going bankrupt, and many people are, unfortunately, because of medical bills, there's something has to change. I am not an opponent to change in the healthcare model, but it has to be done judiciously. And as I've said many times, the change in healthcare starts with you taking charge. My book, Health is a Do-It-Yourself Program, simply is about that, how you can take charge of your own health and make a huge, huge difference in what you do. Every year, coming up in September the 17th to be exact, this year, we will do our keynote, Ageless Health. This year, Ageless Health 2011. It's a one-day event that will transform your health forever. And I want to tell you something about this. It's about taking charge of your health. It's about realizing that your health truly is a do-it-yourself program. And it's about realizing that the body doesn't need any help. It just doesn't need interference. And we're going to teach you how to get rid of the interference. We're going to teach you how to truly take control of your life. You have to think about it. What would it mean to you if you could create maximum vitality, maximum energy in your body, and you could have all the strength that you want, you could have greater physical capacity, and you could live longer, and you wouldn't have the noose of impairment or disease. Well, what the good news is that you can have it all. Between now and June the 20th, if you call our office at 703-698-7117, or you go to our website at rosellecare.com, that's ROSELLECARE.com, you can register and receive a 15% discount on your registration fee. You have some choices. You just go in, and as soon as you go into the front page, it's going to tell you quite a bit about it. But this is a program that you shouldn't miss. If you have any intention whatsoever of really being proactive in your life, I'm telling you, get online today and register online. Save yourself 15%. You've only got a month to do it, 1 month, 30 days to save yourself 15%. And this year, by the way, we've had a company that has stepped in, and they're going to provide organic lunches for you. And it's part of your registration fee, so everybody's going to get it. We start early, by the way. We start really early. You're going to see core training exercise demonstration, and later on in the day at noon, you're going to see a demonstration of Tai Chi and Tai Chi Guan. And everybody that registers is put in a drawing for $1,000 healthcare gift. $1,000. What are you going to learn there? You're going to learn a lot of different things. You can discover 5 things that will change your life and change your health dramatically. We're going to talk about vitamins you must take to stay healthy, things that you have to avoid to prolong your life if you really want to live healthily and well. With all this stuff that's going down with the Nakashima meltdown, guess what? We're going to teach you how to protect yourself from radiation exposures. And unfortunately, we are already at effect. We're going to talk about specific exercises that will generate your fountain of youth and make you look younger and stay younger. And we're going to talk about something really interesting in my vision, how healthcare reform can actually save your life. That means getting government out of your back pocket. Power of nutrition, and we're going to show you how to perpetuate your brain capacity at any age and make it much more keener and sharper. We're going to talk about your structural integrity and your immune system, neurological pathways. We're going to talk about acupuncture. We're going to talk about how wellness begins early on and how to perpetuate it. And all of us are athletes, whether it's in our home or in the workplace. And the one thing that you should never cheat on, if you go to the old masters, Adele Davis, Carlton Fredericks, Linda Clark, and so forth, they tell you never cheat ever, 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 ever on your exercise, but there are very specific ways to do that, and we want to make sure that you have the ability to turn your life around. Go online today at rosellecare.com or call our office at 703-698-7117. There's limited VIP seating. It's a buy. It is unbelievably inexpensive for the information that you're going to get. So register, receive 15% discount between now and the 20th of June. I'd love to have you there. I would love to share everything that we have to share with you. Truly an event, and I'm trying to emphasize it to you because this is an event, by the way, that will be sold out, and it has been the last several years. I don't want to leave you behind. We're going to talk about several things today, things that are applicable to you. When we come back after the news, we're going to talk about why back surgery is not only too costly, but it's ineffective, and there's other ways of getting things done. There's a lot of studies, the government's actually said that, and there's a moratorium that's being tried to be put into place. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. I am live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. Happy Easter to all of you. Hope that you get out and enjoy the gorgeous, gorgeous spring day that's in front of us. It's beautiful. It's stunning. Let's go to the phones. Rosanna, how can I help you? Rosanna? Hello?
This is Dana.
Oh, okay. I'm sorry. She wrote it down wrong on my call screen. Dana.
Yeah, that's okay. I'm 45. In my late 20s, my thyroid quit working. and I've been taking Synthroid for a little more than 16 years, and I want to know if there's a cure. The doctor keeps telling me there isn't.
Well, the short answer is depending how badly they've beat up your thyroid at this point with the Synthroid. How much are you taking?
It's 150 micrograms.
Okay. See, what happens, you know the old statement, if you don't use it, you lose it?
Uh-huh.
So when you supplement any hormone in your body, no matter what it is, and Synthroid is synthetic T4, thyroxine, and when you put that in, your body no longer has to even try to produce it. So when it doesn't have to produce it, then the organ system begins to go into, well, why do I have to work anyway? So it starts shutting down. So let's take it from a place of saying that you still have some thyroid function on your own, and the first question is we'd have to find out why your hormone started breaking down. So you have to do a lot of different things, but let me explain what happens with the thyroid to begin with. The thyroid is stimulated by a lot of different organ systems. The pituitary is one, but the adrenal glands, which is an organ system that is the primary element in your fight-flight mechanism, it stimulates the hypothalamus and the pituitary together to ultimately release TSH, which is thyroid-stimulating hormone.
Uh-huh.
Now, if the thyroid-stimulating hormone has a gland called the thyroid that is receptive to it, then with the presence of iodine and tyrosine and trace minerals, it will produce its own T4. Now, 80% of T4, thyroxine, that your thyroid produces, or Synthroid that comes in your body, or any other source of T4, has to be converted to the active hormone T3.
Yes.
Okay? And that's converted mostly in the liver. And if the liver can't convert it because it's toxic or its pathways aren't working properly, then your body's going to respond just like not having enough hormone to begin with. So you have to find out where it is. But there's also something called thyroid resistance, and that's usually the same pattern, I've talked about it many times, that you get with insulin resistance. It's due to high levels of inflammation in the body. If the inflammatory levels are high, then you can't transport any hormone and you can't stimulate hormone production. That inflammatory piece is the key to so many different things, and in thyroid and adrenal function and pancreatic function, it's one of the primary movers, and it's the one that is most overlooked by traditional care. So let me backtrack and answer your question. The short answer is, in the greatest majority of cases, hypothyroidism can be reversed. Particularly if it's a straight up, it's not a Hashimoto's thyroiditis or anything like that, it's not an autoimmune problem. If you can find out the problem and you can begin to repair and re-stimulate the body's ability to produce what it's supposed to produce, you can reverse the condition. And that's been our experience for many years of practice. The thyroid, like any other organ in the body, has multiple inputs. It has neurological flow, it has acupuncture flow, it has blood supply. So you have to look at all those pieces. Often the nerve roots from the neck are irritated. Sometimes when that occurs, the thyroid's not going to kick in the way it's supposed to. It's like taking a dimmer switch and down-regulating it. If the cranium, the skull bones, which move when you breathe in and out and pump spinal fluid, are locked, the pituitary can be affected. If the acupuncture system is not working properly, and there's several different pathways that affect the thyroid. So you have to look at all of those things. You look at blood sugar regulation as it relates to these pieces. People who let their blood sugars crash, they're not eating enough, and if they're not getting enough protein in their body, are going to have thyroid problems as well. So I know I'm being general because I can't be specific. In your situation, I can tell you that Synthroid is not a good utilization simply because it's synthetic. It doesn't convert as easily as other hormone in the body. You have to make sure that the liver is working and go after the pathways. You have to make sure that all those systems that we talked about. Now, if we extend down line and we talk about autoimmune problems, different story, but also the end product is similar. In any kind of autoimmune problem that has to do with thyroid function, your inflammatory levels are going to go through the ceiling. So you have to look at intestinal tract as well. You have to look at thymus, which is, if you just touch your sternum, your breastbone, right behind that there's an organ called the thymus gland. That has a tremendous amount to do with all of these things that we're talking about. So I hope I didn't confuse you too much, but that's the approach that you take. And then you look at the nutrient basis, you will look at iodine and tyrosine and trace minerals and dietary patterns. You look at how the structural system is working, how the neurology is playing into all this. And again, in our experience over the years, tremendous amount of restoration and resolution can be had.
Well, thank you very much, Doc.
You're welcome. Thanks for calling, David.
All right, bye-bye.
888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. I've been talking about low back pain, and we're going to talk a little bit about why surgery is not a good thing and leaves devastation. But let me go back to our caller here, and I want to tell you a little bit about this adrenal thyroid connection. On a cellular level, molecular level, there's an important note that the stress hormone cortisol is a key in the action of thyroid hormone. One of the cortisol's most important function is to act in synergy, if you will, with thyroid hormone in the receptors of the cells actually at the gene level, the cellular intricacies. There's a guy by the name of David Zava. He's a PhD biochemist and author of an interesting book that has to do with this whole subject, and basically stated that too much cortisol can cause the adrenal glands' response to excessive stressors, causes the tissues to no longer respond to the thyroid hormone signal. So when you're jacked up for any reason, because you're eating the wrong things, or you're emotionally distraught, or you've had injury to your body, and your fight-flight mechanism, the adrenal system's not working, then you can't get the system to communicate properly. It doesn't work as properly. But the tissue fails to respond effectively to that thyroid signal, and you end up with something called thyroid resistance, and that's caused by high cortisol. So when your stress level goes up, you get resistance patterns, and you can tie all this down to other hormones such as we said, insulin and even progesterone and estrogen and testosterone. This whole mechanism as well will cause people to have decreased libido and sex drives, blood sugars that go crazy. Ladies, your estrogens get out of sync, and we see more and more of that in Western society. But, the good news is most of this stuff is fixable. It's not something that you have to put up with. 888-630-9625. That's 888-630-WMAL. If you'd like to talk to one of my doctors, or if you'd like to get a message to me, you can do that by going to our website. Go to rosellecare.com. That's ROSELLECARE.com. And send me a note. Or give us a call at 703-698-7117, and one of my doctors will get back to you, and we'll answer whatever question that we can as effectively as we can. Obviously, we don't know your particular condition without asking you questions, but if you'd like to call us, please do. Let's talk about back surgery again and why it's ineffective. If the present course of health care doesn't change in this country soon, America's going to be financially broke. And as I said earlier, I'm one that says that we've got to do something about the delivery system because it ain't working so hot right now, but not the way it's being done right now. It's the cost of delivery right now on the Obamacare is going to kill us. But there's ways of cutting the cost of healthcare back as long as you're willing to take control of your own life. Most of us fail to realize the impact economically of what happens in the medical industrial complex until you feel it in your own pocket because of unpaid medical bills, right? 62% of all personal bankruptcies filed in the United States in 2007, 2008, according to a Harvard study, happened because of healthcare bills. And it's awful. And 78% of those filers had medical insurance. And it's not they didn't have insurance. It's just that it went well beyond that. So you're not going to get covered anyway. So you have to decide that you're going to do something different, that you're going to step up to the plate and take control of your health, because if you don't do that, we all could be in real trouble here. You're not just doing it for you, but we're doing it for all of us. It's unfortunate, truly, truly unfortunate that we have this situation. And whether you're on Medicare, you're on Medicaid, you have private insurance, it's a fiasco. Unless you're Bill Gates and you have a problem, or, somebody who has deeper pockets than most of us want to imagine, you got a problem that could happen at any time. And just because we're going into this one-payer system, which I believe ultimately is what they're trying to put into the format, you got problems. Healthcare reform is not a luxury, my friends. It's a necessity, and we can't defer doing it. Soaring health care costs are getting out of control. They're unsustainable, and the premiums are going to become worse. This is not something that's going to cost you less, and your coverage is really not going to be any different than what it is now. So what's the bottom line? If we're having people say that we got to do something about the $2.4 trillion healthcare bill that's out there, what's the step? The step is that you have to take control of your life. You have to take control. Jerry, thank you for holding. How can I help you, sir?
Yes, a question, please.
Yes, sir.
Are there any natural ways any proven natural ways to reduce the effects of an enlarged prostate? Any way to shrink it or just to reduce it? Any natural ways?
Sure. I can tell you a lot of different ways of getting it done. It's specific based on the patient, but I can give you some general guidelines. 35 years ago, when I graduated from school, the first paper that I wrote for graduation was zinc and the prostate gland. And the evidence then was amazing that if you had adequate zinc levels in the body, serum zinc levels, that you saw significant resolution in benign hypertrophy, enlargement of the prostate gland. Zinc sulfate. There are many different forms of zinc, but zinc sulfate was used in the study, and the research at that point was amazing. So now you add that. And by the way, remember we were talking a little bit earlier about inflammatory responses? Same deal here. Okay, you have to get the inflammatory levels down. And that means dietary patterns of sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. That stuff's got to go. And you got to eat tremendously high levels of vegetables. Don't fry them. Your protein levels should be fish and chicken and turkey and occasionally some organic free-ranged beef. And get your diet so it's very, very alkaline. Having said that, saw palmetto is another one. The liquid forms are always the best. Use maximum dosage 3 to 4 times a day. We use low-energy light laser as well. We use acupuncture. But you have to approach it from many different parameters. The key is your willingness to participate in your own biochemistry. If you do that, it can be changed. So there's lots of things out there. You want to use organic sources, but zinc, vitamin E, saw palmetto, that's where you begin. And omega-3 fatty acids, whatever your body will tolerate. If I can be further use to you, Jerry, please give me a call. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL. Phone lines are lighting up like crazy, and I'm going to try to get to those that I can, and those that I can't, get a hold of us at RoselleCare.com or call us at 703-698-7117. Susan.
Yes.
How can I help you?
Yes, my mother is 93 years old and has a very itchy rash, almost a year now, and no one seems to be able to figure out what it is.
Where is the rash?
On her scalp, on her buttocks.
What kind of medication she's taking?
She's only taking bioidentical hormones.
Okay. How much of it is she taking both estrogen and progesterone, or is she taking?
Yes.
Okay. It can be as a result of that. If the liver is not detoxifying the hormone the way it's supposed to, it's going to build up, and because the skin is the largest organ of elimination, it's going to go through the skin. So you have to look at that. At 93 years old, I'm not sure that being on bioidentical hormones is the best thing, and you have to look at what the levels are. If everybody was doing what they're supposed to be doing, you have a natural life cycle relative to how the body works, and I would look very carefully at that level. But check that out. I think you're going to find that one of the side effects is simply that, is rashing.
Well, she's gone off of that. Actually, she's gotten the rash in the last 10 years way before she ever went on bioidentical hormones. And this last time, we actually had her go off of them for several months, and the rash continues.
It didn't. Okay. Has anybody bothered running functional tests on her liver to see if any of the liver enzymes are elevated?
It's all normal. I mean, yes, they have, but they're all normal.
Okay. It often will not show. So what you need to do is you need to get somebody who can do a functional medicine study, and there's a genomic test that will allow you to see the actual phase 1, phase 2 breakdowns, cytochrome P450 and so forth, and whether or not it's actually conjugating things. You may not show as liver damage, but if it's not conjugating properly, then there's going to be a backup, and any of the xenoestrogens or the estrogens that you're taking artificially will cause that issue. If you get a hold of me on my website, I will tell you specifically which lab and who to check out. Just write me a note at rosellecare.com, and I will get the data to you very specifically.
rosellecare.com.
Okay?
Okay.
Thank you. Appreciate
Shout
it.
out to Arlene. Thanks, R, for letting me know about Dr. Roselle. Love you. Happy Easter.
Thanks, Susan.
Bye, Dr. Roselle.
Happy Easter to you. Barbara, how can I help you?
Hello.
We got about 30
Robin
seconds.
McKenzie wrote a book called 7 Steps to a Pain-Free Life, How to Rapidly Relieve Back and Neck Pain, and I'm wondering what you think about his McKenzie method for curing back problems.
McKenzie method is excellent. If the structural pieces aren't in place, if the biochemical pieces aren't in place, no exercise will help you. McKenzie approach came out of New Zealand. He's they're a physical therapy group. It's good stuff. We could spend the rest of the program talking about it exactly, but I'm out of time. But having said that, if everything else is going the way it's supposed to, it works very nicely. Thank you for your call. I'm sorry that I can't spend more time with you. Give me a call at 703-698-7117 or go to rosellecare.com. I apologize to all of you that are online waiting, but I will answer you if you get a hold of me. I'm here every Sunday at 12 noon bringing you the most up-to-date information on integrative health care. This is Dr. Tom Roselle. Happy Easter.
Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, rosellecare.com. That's rosellecare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.